Morning, everyone. Sarah, I'm going to hand it over to you whenever you're ready.
There we go. I was having trouble getting to my unmute button. I'm using my phone instead of my computer. Good morning, everyone. Great to see you on this spring morning. Fun to see the influential women in your lives. And I know one person said it was it's hard to choose because there's been so many, and I think that was my thought too as I was reflecting on it. That you know, from my mom to teachers to just other supportive women I've met along the way, to many of you who are on this call. You know, I stand on the shoulders of many great and amazing women, and look forward to hearing from a few today. We are talking today about the state of housing, and particularly around the state of housing for those who are experiencing homelessness, and look forward to hearing from some longtime partners at the Damien Center and Horizon House and CHIP. This is an issue that is in almost every conversation I think we have with folks that are in human services in some way or another. Housing comes up, and it is something that, you know, a decade or so ago, it would pop up here and there, but we were still known as a city that had a lot of affordable housing, and we find ourselves now not being able to say that really anymore, and really in a point of crisis around how do we make sure that we can put housing first for people who are struggling, so look forward to hearing more from our longtime partners here and having some good conversation around that. So Deja, I'll turn it to you to introduce our speakers.
Thank you, Sarah. Well, good morning, everyone, and happy Friday. Welcome back. Happy to see some familiar faces and some new names as well. If you are newer, my name is Deja Cyrus, and I currently serve as the Manager of Organizational Development at United Way of Central Indiana. So I'm very, very excited for you all to join us for a very relevant discussion, as Sarah was just saying, around housing and the current housing crisis of homelessness that we're facing in our community. So today we have curated a very unique experience for you all. I'm actually very excited because since I've been at United Way, it's one of the first conversations that we've had in this format. This morning, we'll explore the topic of housing in Central Indiana by hearing from 3 different community leaders from 3 different organizations, from also 3 very different angles as it pertains to housing. So I am thrilled, and I should probably do to the next slide, to introduce to you Chelsea Herring-Cozzi, the Executive Director of CHIP, which is also the Coalition for Homelessness Intervention and Prevention, but you'll commonly hear it referred to as CHIP. Alan Witchey, who is the President and CEO of the Damien Center, and last but certainly not least, Lillian Herbers-Kelly, who is the Director of Housing at Horizon House. All of these are local organizations and all serve a quite unique mission, and all of them are equally relevant to the community that we're serving. So if you feel comfortable coming off camera, please do so. We really want to take advantage of the time that we have today by having this be as conversational as possible. If you have any questions, drop them in the box. If you have any questions and you feel comfortable coming off mute, please do so. Like I said, we want to make sure we use this time to get all your questions answered and exchange as many resources as possible. So without further ado, I want to bring in our speakers. And Lillian, Alan, Chelsea, if you want to say good morning or anything, feel free. But if not, I want to jump right in. I know we only have an hour.
Okay.
Okay, perfect. So for those who may be unfamiliar, Are you able to just give us an overview of your organization and how it distinguishes itself from other organizations in the Central Indiana community, whether they are housing based or not? Chelsea, I'll start with you.
Sounds good. Good morning, everyone. So glad to see so many friends and familiar faces and names on this call. Appreciate being invited into this space. As it was mentioned, I'm the executive director with CHIP, the Coalition for Homelessness Intervention and Prevention. For those who may not know, CHIP's been around for about 28 years now, founded in 1996 after a group had been coming together in the late 80s, early 90s called the Homeless Volunteers Network. To really start coming together as cities across the country were seeing significant increases in homelessness in the mid to late 80s and trying to figure out why, what was driving that, and how do we start to organize around solutions and strategies to address it. CHIP was formalized in 1996, actually through a feasibility study from United Way, the Central Indiana Community Foundation, and Lillian Endowment to say, does Indianapolis need an entity that can really start to unify folks around a common understanding of the issue of homelessness, and then start to organize around strategies to address it? And that was really CHIP's foundation, is to be a community convener, connector, strategic planning partner, and to really help inform how do we come together as a community, drawing on our collective talents, resources, expertise, knowledge to address a really complex issue that was emerging across the country. And 28 years later, that really still is our mission. CHIP's, our mission is to partner with the Indianapolis community to advance a shared vision to end homelessness by inspiring collective action and advocating for permanent housing solutions. There's a lot in there. I want to talk a little bit about collective action and what that means. What it really means, it's based on kind of 5 tenets of collective impact. We try to unite around a shared vision and understanding of homelessness. We have to have an understanding of what drives homelessness to really understand what the solutions are and to try to get everybody on the same page around that. Our Indianapolis community has united around the shared vision that everyone deserves to be housed and connected to care. And what's behind that vision, what's underlying, is really a belief that housing should be a human right. It's not treated that way currently in our country, but that's what we're advocating for. And working towards housing in what Deja mentioned, or Sarah mentioned, a housing first philosophy, meaning people shouldn't have to earn or deserve their way into housing. For those experiencing homelessness, housing should absolutely come first. You have to solve a housing crisis before anyone can work on any other mitigating factors that may have contributed to that experience. And so that's really a lot of what we work towards. We do that by being the data lead for Indianapolis. So we operate what's called a homeless management information system. It's a community-wide database that really looks at who's experiencing homelessness in our community. How does that change? How does that differ by different populations or demographics? Who's accessing services and what kinds of services? And how do we compile all of that data to really understand the interventions that are most impactful? And so we serve as that data lead. And part of collective impact is we have to have a shared understanding then through data of what success looks like. How do we know that we're doing a good job? And so we look at a lot of different indicators, including equity. Are people being served in equitable ways? Is there disparity in the system? If so, how do we target and address that? Are we improving or enhancing housing choices for people to go to who are experiencing homelessness? Are we reducing the length of time people spend or experience homelessness? And once housed, are people staying housed? Are they working and achieving longer term housing stability? Part of CHIP's role is also to help coordinate an approach in Indianapolis so that we're all reinforcing each other's activities and working as a more coordinated homeless response and housing system. CHIP's role in that is we operate what's called a coordinated entry process. And essentially what coordinated entry is a recognition that we have scarce resources. We don't have enough resources for everyone, including housing. So how do we really understand through assessment what people's needs are and vulnerabilities are so we can match the most vulnerable to the resources that are out there. We also support a lot of the communication across the sector, again, connecting, convening, bringing people together so we all know what each other's doing. The whole goal is to lift each other up and enhance what's out there and not be duplicative. And so how do we make sure everyone knows each other's roles and place in this work? And lastly, CHIP serves as what's called a backbone organization to this collective work. So having staff that can help convene and bring folks together, provide the data to support providers and to do a lot of the reporting for our community. And through all of that work, we hope, and our vision is as an organization, we envision an Indianapolis where one day everyone has a safe, stable, and affordable home and is embraced by compassionate care and an inclusive community. So that is a little bit about CHIP. Would love to just pause there, Deja, and see kind of where we are in terms of any comments or questions.
Yeah, we can definitely open it up and kind of get questions as we go. I know there was a lot of information there, and sorry, was on the wrong slide. But 28 years is a very long time, and I'm sure there's just a solid foundation in which CHIP is operating on, and it seems very connected to the roots that it began with historically. So if there are any questions before we transition over to our next facilitator, then I'm definitely open to that. If not, we'll just keep it moving on, and we have a portion at the end that will open up for question and answers as well. So,
and Deja, if I could add maybe why people are thinking really quick in terms of some specific programs and services that I didn't mention. CHIP also does a lot of listening in the community to understand where there might be gaps and where we might be well positioned to fill those gaps to ensure there are different programs and services that are available to the entire community. And so some of the programs I'd like to just mention, highlight, we can talk about later. We operate what's called a Street Reach Indy Flexible Fund. It is a community-wide flex fund that case managers, navigators can access as they're working with individuals experiencing homelessness on their way to housing who might face some financial barriers that a lot of grants don't pay for. And so we hold that fund and we help fundraise for that fund that is then available to the sector as they're working with folks to overcome specific financial barriers to housing. We also hold a lived experience compensation fund. We know that those with lived experience of homelessness are the best people to inform solutions and to tell us what's working and what's not working, where the barriers are. And so we want to make sure people with lived experience are at every table across the community. And we have a fund to make sure that their time and expertise is compensated for that. And so we hold that fund as well. And then we were fortunate a couple of years ago to receive Day One Families funding from Jeff Bezos to really focus in and target strategies for family homelessness. And so we've been working with community partners to re-grant that funding to organizations that are working with families specifically, as we know that is a growing population of people experiencing homelessness, particularly families with larger numbers of children. And so really working to do some targeted work around family homelessness.
Wow, that's amazing. Thank you, Chelsea. And then now we'll transition over to Alan Witchey of the Damien Center to just give us a brief overview of his organization, the mission, and some of the strategies that they utilize as well.
Sure. Thank you. And thanks again for inviting me here. If you're not familiar with the Damien Center, we've been around for almost 40 years now. And our current mission is to, Damien Center's mission is to be a trusted partner, providing services, education, and advocacy for all people living with or at risk for HIV and any person seeking a safe and welcoming home for care. We're a comprehensive agency, so we're trying to provide a full scope of services for people who come in our doors, and that includes everything from mental health to medical care, pharmacy, case management, food, housing, employment, harm reduction services, gender affirming care, all kinds of things that our patients or clients walk in our door in need, to be able to get them all under one roof. So we started housing very early in our career. in the early years of the HIV epidemic, we saw primarily we were around to help people die with dignity who had HIV. Most of those people were gay men in central Indiana. They were oftentimes, we would have 30, 40 people die a month. And we were having a group that were sort of abandoned by their families and their faith communities and their employers. They would go through their money very quickly, and so they would end up homeless on the streets and the shelters unless we could find ways to support them. So very early on, housing was a key foundational value for us. And it's continued that way throughout, even though our medications are so much better for people living with HIV, and our mission has expanded to include certain relevant populations that are connected. And so we have a very robust housing program now, I think. And we still have probably maybe about four key foundational philosophies in our housing. And one is housing first that Chelsea was mentioning, and that is, about rapidly rehousing individuals with that focus on client choice, but no prior conditions. So we don't require things like sobriety or employment or any required services when we're housing people. We also firmly believe that housing is healthcare, and that means that when people are housed, they are actually healthier, and that allows them to live happier and better and more self-sufficient lives. We're a big believer in harm reduction, so we don't require people. We sort of meet people where they are. We teach them risk reduction behaviors and healthy behaviors. But we believe that leads to life stability and stability in housing. But we never require sobriety or abstinence in order to access our programs. And of course, we believe in equity as our final one, which is that we really do believe that LGBTQ equity and social justice are key pillars in solving homelessness. We have 5 key populations that we work with. So people living with HIV, LGBTQ plus populations. We also do survivors of human trafficking and domestic violence, young people 18 to 24, and then our final population is elder LGBTQ and HIV populations over 55. And then we have about 4 key strategies that we do, which is homelessness prevention and diversion. So we work to keep people from becoming homeless or coming into the homeless system. And then we also do primarily rapid rehousing, so immediately pulling people out of homelessness, rapidly rehousing them. And then we also do scattered site permanent supportive housing for people who have a disability and will permanently need support. And then a final strategy, of course, is wraparound services. We provide those various services I talked about at the beginning to anyone who accesses our housing services. And we find that is incredibly helpful in creating stability amongst the people that we serve. And last year in 2023, we served almost 1,000 people through our housing programs. We had over 380 that we diverted from the homeless system. We have about 256 that we helped on short-term assistance. So that is that short-term rapid rehousing or short-term rental assistance that just help somebody or a family get stable for a period of time. And then we had about 320 individuals that we worked with on permanent supportive housing through the year. And most of our clients there is a large portion of them that are living with HIV, and probably about 2/3 of our housing population identify as LGBTQ plus, and about 70% are Black, and most of them are age ranges just sort of spread out between 25 and 64 pretty evenly. So that just gives you a sense of what we do, who we serve, and how we do it. And I'll turn it over to the next person.
Thank you, Alan. And I know you mentioned that in 2023 you served 1,000 people. Is that typically your average amount of clients served?
Yeah, it's up. I mean, every year it goes up. So what we see, what we're seeing is that we're having more and more people every week, every day coming in our doors that are looking for housing support. And we it's very hard to always get increases, but we do, like, so this year through the Continuum of Care program, we just got housing funding that targets domestic violence. And we had previously been working on human trafficking. We get funding directly from the federal government, Department of Justice, to serve survivors of domestic violence, human trafficking. And so there are ways sometimes to grow it, but a lot of times you do find yourself year to year with similar resources and more people, and trying to balance how you're going to serve more people with the same number of resources. And I'm sure Lillian may say that same thing in a minute. Yeah, so it's definitely an increasing issue in our community. And if you're, in particular for populations that we target, those very unique populations, like LGBTQ populations, have a much higher homelessness rate than heterosexual populations. And in particular, if you're trans or non-binary, it can be very hard to access some of the programs in the community. And so those populations really depend on us to help them out. They don't always feel like they have other options or other places to go.
Nice. Okay, completely understand. Well, thank you, Alan. And Lillian, we'll continue to transition right over to you and keep us flowing.
Hey, wonderful. Hi, everyone. Thank you so much for having me today. It's telling me to unmute myself, but I already did. Yes, it was great to go after Chelsea and Alan, who definitely queued me up. So thank you guys for that. So Horizon House, we're in our 36th year, and Horizon House kind of came about because, yes, Chelsea teamwork, came about to fill a need for there to be a place for folks experiencing homelessness to be. And so we started as a day center, service center, and we've really evolved in lots of ways since then. So Horizon House currently sits at 1033 East Washington. We have a large service center, and I want to kind of give you the gamut of what we do. So our current mission is that we support our neighbors experiencing homelessness with integrated, comprehensive services so they can secure and maintain housing. So we do a lot from out of the house and in the house. So Horizon House manages the professional blended street outreach. So we have outreach teams that are collaborating with many different agencies, which is amazing because everybody has different niches that they're working in, and populations they serve, and things that they are better at. And so we have outreach teams going out and engaging with people who are living outside unsheltered. And it is getting resources to those folks. It is building rapport, trust, encouraging them to engage in getting the coordinated entry assessment done so that they can be eligible for housing. So we do that. We also have the service center that focuses on basic needs, yes, so laundry, showers, phone access, mail. And in the service center, we have case management, helping folks, again, get in the coordinated entry system for housing, secure documents. We have an employment program. We have a reentry case manager who is specializing in working with the agencies that are doing reentry. And that has been a phenomenal thing. We do second chance workshops in Horizon House where people can get their license reinstated. So Horizon House is kind of, we've moved to trying to be a one-stop shop. So we're working on, I'm not, but my beautiful colleagues are working on getting the BMV in to do IDs, Marion County Health Department to get birth certificates. So all to collaborate and coordinate services so that someone can get to housing. And then the other piece of Horizon House that started in about 6 years ago, actually, this month, is our permanent supportive housing program. So that's what I've been mainly working on. And so we, Alan explained what permanent supportive housing is. It's a specialized kind of housing for people who are eligible. So homeless a long time, a disabling condition. We operate a scattered site permanent supportive housing program. So currently we have 235 households with over 300 people in them. About 20% are families. I made that graphic to kind of show you how far our reach is. So many of you on the call might work in areas where you work in an area where we have people housed. And so we have case management who are doing community-based case management, following the leads of the folks they're working with to meet their needs, make sure they stay housed. We follow the housing first and harm reduction philosophies and meet people where they are. We have peer supports, which has been a phenomenal thing to add to Horizon House. So we have peer supports working in the service center, which has really been awesome to peers connect, certified peer recovery specialists connect, build that trust and kind of help them navigate through all the systems. And then we also have folks in housing as well, which has been a wonderful add to our program. We find lots of challenges in housing. I saw Chelsea mention the cost of housing. We also are completely Section 8 voucher based. And Indiana is one of the states that landlords can say, no, I'm not going to take a voucher holder here. Some other states have protections around that. So it actually limits the places you can live based on that, just having a voucher. The two things we have coming, which is really exciting, is Horizon House has its first building being built next door to our service center called Compass on Washington. It's going to be 36 units of permanent supportive housing, and we're working with Inglewood Development Corporation just down the street as our property manager, and that's going to be awesome to bring folks out of homelessness. We are also operating our first kind of bridge master leasing project where we're going to be bringing folks out of homelessness, working on whatever they need to queue them for permanent housing. But the point is to have a safe place to be in the interim. So there's a lot of things on the horizon, pardon the pun, but the biggest piece is there's not enough. And so we have to continue to work toward building pipelines for bigger and more affordable housing for those we serve, because they deserve it. So happy to answer any questions anyone has. Thank you.
Wow, Lillian, first of all, amazing. That is awesome. Congratulations to Horizon House. And I'm a huge fan of puns. So love it. It's a great way to get the morning rolling. But thank you all for sharing. I want to dive into some panel questions that we have before we open it up to Q&A from the audience. So if we could kind of dive into what impact does housing have, whether it be supportive housing, rapid rehousing, homelessness, whatever the case may be, what impact does housing have on community-based organizations who focus may not be housing, who think that they may not be aligned with housing as a topic? So I know you guys work together a lot, so you'll probably let this flow a little bit, but for now, Lillian, I'll start with you and then we can transition.
So say the question again. I got distracted.
Yes. No, you're fine. Just what impact does housing have on community-based organizations who focus may not be housing specifically?
Got it. I mean, housing is healthcare. As Alan said, housing is everything. Housing allows people to really be able to focus on anything they need from there. We have, when there are maybe a family and their children don't have stable housing, that impacts their education and their ability to maybe get to school and all of those things. And I worked at Bright Lane School on Wheels a long time ago, and just saw the impact of what not having a permanent place did to children and to families. And so it clouds your ability to focus on anything else. So if folks are working on education or you know, a training program, but someone's unhoused, that's going to be a really tough thing to overcome. So housing really is everything. It gives people the ability to settle, to feel safe, to feel fully able to meet all of their potentials.
Yeah, I couldn't agree more. And then Alan, we can transition to you, and then Chelsea, we'll let you chime in as well.
Yeah, I think Lillian did a great job at sort of probably articulating all of our philosophies. And, you know, it can be really hard. I think if you're an organization that doesn't have a primary focus in housing, it's sort of like trying to figure out, you know, what's my role? What can we do? What can't we do? And I do think that like sometimes that leads to, I mean, I think there are several organizations that never used to do housing, and they've stepped up to do housing because they saw so many clients and people coming in their doors that were struggling with housing. And the reality is it's sort of it's bleak if you think about it too much, which is that the need is, you know, like this big and the resources are this big. And so there's always a mismatch between what the needs and the requests are in the community versus what we can as a group of agencies even provide the support to people. But it really helps. I mean, it's not I don't think of it as a competitive thing. I think it really helps when every organization starts to own that housing is not a separate thing, but it is sort of a foundational piece to the work that everybody does. And we know that if you're you know, struggling with housing instability, you can't really focus on educational attainment. You know, it's very hard to focus on you know, growth out of poverty. It's very hard to focus on any of those things that Lillian was talking about too. It is the way that it's just sort of built into a lot of the things that we take for granted as individuals when we have that stability and the fact that our privilege and having stability in our lives, we oftentimes forget or don't know or never had that experience, how hard it is to get out of it. When somebody has an experience with houselessness, it takes 2, 3, 4 years to recover. It is not hey, I'm just going to go out and get a job and get stability. And some people, you know, find it very difficult to ever recover. And so I think that along the way, if you're in human services, you're going to encounter people that have this experience or have recently come out of the experience and are still recovering from it. And so it's helpful if at least everybody is aware of it, knows how to refer people, but also recognizes that there may not be as many supports or options for people as we wish there were. So understand that, you know, everybody's working the hardest we can, and to try to increase the resources, which have increased a lot. CHIP and the city have really worked hard to increase them, but it is still a reality that every year we turn away more people than we help in our organization. And so we would welcome other people, even small ways to help people think about housing, to talk about housing, even just to find out, are your clients struggling with housing is important for you to know, and how you serve people. So I think everyone has a role to play in this particular issue.
That's a very good point, Alan. Thank you for sharing. So I do want to highlight that if anybody would like to reach out to Chelsea, Alan, Lillian, I'll be sending out their contact information after the call. So use them as resources. Like they said, that housing is the foundational piece to the work that we're all doing. So if you have any questions, need any resources, please reach out. And Chelsea, before I transition to you, I want to highlight Christy's message in the chat box. She said job retention has been a huge metric that has increased for us since providing wraparound support for basic needs, with housing being our number one requested barrier. So, Christy, thank you for sharing. Chelsea, I'm going to transition to you to kick us off or wrap us up with this one. But if you want to speak to that comment and then dive into the question, please feel free.
Yeah, I mean, there's not a whole lot to add to what Lillian and Ellen said. I mean, so I'll just reinforce that housing is the foundation, and it is so hard to work on any of these other factors, getting a better job, retaining that job, improving health outcomes, improving educational outcomes without stable, safe, and habitable housing. And I want to add that word because housing has to also be quality housing. And we have issues with that here in Indianapolis and in Indiana as a whole, in terms of having housing that is affordable, safe in various parts of our community so that we're not relegating folks to the same neighborhoods where there may not be assets and social capital. And it has to be habitable. It has to be up to standard so that we're not saying to folks who are leaving homelessness that what you're going into may not be a whole lot better than what you're leaving. That's not okay. And so, you know, I'll just say that the lack of housing impacts physical health outcomes, it impacts mental health and wellness, it impacts safety, it impacts education. I mean, all of the things, right? And so I think my challenge would be, even if you aren't directly working in a housing space, housing is an issue you're going to face as you're working with folks. And it's going to be something that comes up. And I would encourage people to just ask that question, whether you're working on health and wellness or food safety and security or education. Go one step further and say, and let's talk about your housing situation. And because that's a huge part of the foundation. And I think it just reinforces Christy's point. Like, it's really hard to work on other things if people are struggling with that safe and stable housing. And so making sure that there are good connections. If you're not an organization that specifically has housing resources, how are you then partnering and connecting with those that do? The other piece I would say is advocacy. Whether you're in housing or not, we need your voice at the table to advocate for better housing choices and access, reducing barriers to housing, and continuing to develop more affordable and safe housing. There's a huge report, and I'll make sure that this is shared. There's a huge report that was just released yesterday by the National Low Income Housing Coalition. That's showing 139,000 affordable housing shortages here in Indiana alone. That is up from previous years. So we're at a deficit right now of about 140,000 affordable units. And to change that, it really is going to take all of us across sectors to make our voices heard and to advocate for more investment in affordable housing and lower barriers to housing and higher protections and education for tenants.
Wow, thank you, Chelsea. And kind of rolling into our next question, what role can nonprofits play in advocating for policy changes to support affordable housing? Like, is there a resource that they should be using, a process that they should be following, strategies that they should be implementing? What pointers can we give to community, like CBOs on this call specifically, to advocate for the policy changes that we need to see?
Deja, you took it out of my mouth because I just put it in a chat. Prosperity Indiana and Fair Housing, I'm gonna blank on their entire name, so if somebody has it, really does a great job of doing, oh yeah, exactly. There are lots of people who are watching bills and talking to politicians, and they do a really great job of synthesizing all the things being heard, and a great job of saying, this is a bill we're concerned about and why. So they're policy experts, and I think following them is a really great start so that you can know, like, how does this bill impact the work we're doing? How can we show up for it? So I think that is what I would say is follow the experts who are telling us, who are reading, because it's also really hard to interpret bills sometimes, at least it is for me. And so I think people who are really good at that really synthesize it really well.
Thank you, Lillian. Alan,
Yeah, the
Chelsea.
only other thing I would say, I think Lillian's right on, is that that you as a nonprofit, you actually can lobby and advocate. You have to, there's laws that allow, a lot of times people think they can't. And so it's really important to know that you can have an opinion and you can express it. And you obviously there's just rules about the balance of how much of your time and budget go into that kind of work. But I think it's really good. And hopefully Chelsea is probably the number one person here on the call that really does take an active role in kind of looking at that and thinking about how the advocacy should work.
Thank
Yeah,
you.
thanks for that, Alan. I'll just add, and I kind of threw this in chat. I think there's a lot of, misunderstandings about kind of that line between lobbying and advocacy. And, it really is folks on this call and the folks that you're working with and representing that are the experts in what you're seeing on the ground, how that's impacting individuals and families. And lawmakers, whether you believe it or not, lawmakers do want to hear from you. And hear what are the experience of folks in the community, what's your data showing, and there are a lot of opportunities to sit down with policymakers to just do education, and to help inform them on how bills may or may not impact the people you're serving. We had great experience with that this past session, and I'll give Lillian a huge shout out. She sat down with the author of a bill that was really problematic, that was working to criminalize homelessness. And Lillian just did some education about the impact of supportive housing, and how supportive housing and housing first are evidence-based approaches. They are strategies that are really working to support folks in housing long-term. And the author of the bill just had no idea. She wasn't well informed on that stuff and appreciated the opportunity to be more educated on that. And so I would say, take those opportunities to have the conversation, to open the dialogue and to share what you all see every day, with the folks that you're serving, with those at the State House, because they often don't have that lens of what's happening on the ground and in the communities.
That's a very good point. I had some additional questions, but we have quite a few questions in the chat that I want to address. So Darcy Palmer from Big Brother Big Sister said that we regularly provide rental assistance to families who are in an in-between moment. Our relationship with families often makes us a first call in these moments. Additionally, our team helps connect to other resources. Do you have advice on the best starting points for referrals for additional housing support in Marion, Hamilton, or Johnson counties, which are their service areas? And she added, just wondering if we're missing any resources that could be helpful. So Lillian, Chelsea, Alan, any resources that you think might be useful for them to use at Big Brother Big Sister, or that they should be making sure that they are using?
Yeah, I mean, I would say the number one resource we distribute all the time is the Handbook of Help. Chip puts it together, annually updates it, and it's a great resource tool. We pass it out to our clients, our patients, anyone who comes in all the time. There's an online version, so we pass out the scan code a lot. And that's the thing that I would tell anybody if you're looking for a resource for your clients. That is the number one best thing to have. And it's also, again, setting expectations, the best possible way, that just because you have a nice resource guide doesn't mean everyone will be able to get help or assistance. And it is a really hard thing. I just say this, that, like we talk, our staff, like part of us taking care of ourselves sometimes is having this conversation about all the people that we're not going to serve and we're not going to be able to help, in the sort of the emotion that you have to deal with, because there's some wonderful, amazing stories, and there are just as many really difficult stories that we aren't able to help with people. But hands down, Chelsea keeps that book up going, and it sounds like it's coming. The new version's probably coming out soon.
Thanks for that shout out, Alan. That's really helpful. Yeah, we'll definitely make that available. There's a hard copy and then an electronic copy that's also in Spanish and Haitian Creole. The other thing I'll mention in terms of resources is, there's a whole spectrum of housing needs, right? So if you're working with a family or individuals that are experiencing what we would say literal homelessness, meaning they're staying in an emergency shelter, transitional housing, or place not meant for human habitation, make sure that you're connecting them with what we would call a coordinated entry access point. There are access points in organizations across the community. Horizon House is one. But having that coordinated entry assessment becomes critical to then getting connected to permanent supportive housing or rapid rehousing. If you're working with a family that maybe hasn't quite gotten to that place, but they are at risk of losing housing, they're in eviction court, there's some really great upstream work being done, homeless diversion work, and diversion meaning that you probably have lost housing or you're within imminent risk of losing housing, but you haven't quite become homeless. How do we intervene then to prevent homelessness, which is the ideal strategy, right? We don't want people to experience homelessness. And the Homeless Initiative Program is doing a lot of work around diversion. They have a number of diversion specialists, some flexible funding, particularly for families who may be facing eviction or on the cusp of homelessness. And so I would reach out to the Homeless Initiative Program, Melissa Bell. And then Outreach Indiana is doing some specific work for diversion for youth and young adults as well. So those would be two other resources that I would mention. If you're working with folks who are at imminent risk or maybe have lost housing, but they're doubled up, maybe couch surfing, to connect with HIP or Outreach Indiana to talk about diversion and housing problem solving.
Thank you, Chelsea. And I see, Lillian, that you were able to provide a response. I wasn't able to dive in, but I do want to highlight Christy's question are there any additional resources for individuals facing mental health crisis who are experiencing homelessness? So Lillian, if you want to speak to that, I saw that you provided a response, but.
So I am not an expert on it, but well, first, the professional blended street outreach, our outreach team partners with a lot of different providers to ensure that we have people who can address mental health crisis on the street. There's also the MCAT team, but anyway, so there's clinicians on that team, and there is a downtown team. There is also NEW, which is a clinician-led community response, CLCR. It is 24 hours, 7 days a week, but it's only downtown right now. But if you're interested in looking into it, hopefully it expands, because it looks like it seems to be a really phenomenal addition to our system. And the point is to have them attend first without paramedic or officers, and they assess whether or not it's something that needs to be escalated.
And also, just to add to that, obviously all the community mental health centers, Sandra Eskenazi, Adult and Child, all those places are great to reach out to. They oftentimes have very long waits or can be complicated systems sometimes to get through. So it's always good to look for, there are lots of organizations too, not community nonprofits, that have mental health programs and mental health providers. So you can look to see who's offering, like we do offer it, but we tend to offer, again, for our very specific populations. But other groups are also offering. So it's good to just kind of look around to see who has those services.
Perfect. Thank you both for sharing. And James, I want to highlight your question in the chat. I know you mentioned, or you asked if they could speak to the macro issue of the declining supply of available housing in Central Indiana, and if Central Indiana or Marion County has a master plan to address the supply of affordable housing. Chelsea, I know you said that the next version is being released this month. So anything that you want to add to that?
Yeah, so thanks for that question, James, and for the plug for Greg Colburn's work. So I will just share, and I'll send this to Deja too. There is a phenomenal book released last year by scholar Greg Colburn, who's working out of the University of Washington, called Homelessness is a Housing Problem: How Structural Factors Explain U.S. Patterns. And it really dives into the notion that housing markets drive homelessness and housing instability in communities across the country. And that's really what explains variation in homelessness. It's not so much grounded in the kind of individual level factors that people often think are driving this issue, like substance use, mental health, things like that. It's really about housing markets. And two things that we have to really pay attention to here in Indianapolis and that we understand are contributing to this crisis are rent rates, which between 2021 and 2022, we saw a 30% increase in rent rates across the board. That's huge. That increase in rent without having similar kinds of increase in income and wages becomes a significant factor in driving housing instability and homelessness. And so I think the first part of the question is, how do we really start to talk about rent rates? Indianapolis and Indiana are no longer being considered affordable places like they used to be. And so those rent rates have a significant impact, both on the resources out there because they don't go as far, and in terms of starting to price folks out of housing. The other indicator that we have to pay attention to are vacancy rates. How competitive is the housing market? And the kind of threshold is if your market falls below 5% vacancy rate, you've got a super tight market, meaning there's not a lot of units out there. And at the end of the day, who gets left out of those units? The most vulnerable, people with barriers to housing. And Indianapolis is below a 5% vacancy rate. So that's significant, meaning there aren't units out there for those at the low end of affordability or those trying to exit homelessness to access, because then landlords get they can be more particular about who they rent to because there aren't a lot of units and we're all kind of competing for the same units. So that doesn't answer the solution. It shows some indicators that if we don't quickly pay attention to and respond to, we're gonna see the problem worsen. So James, we are actually waiting for the city to release, and we hear it's coming maybe this month, kind of a action plan for affordable housing development and what that looks like for Indianapolis over the next several years. There has been a lot of intentional work to develop more supportive housing. As Lillian mentioned, Horizon House is bringing 36 brand new units online this year, but we need housing across the continuum. And so we're hoping to hear more from the city about what that plan looks like here in the upcoming years.
Thank you for sharing, Chelsea. And I think we can all agree that in some way, shape, or form, we or someone that we love has been impacted by this inflation and just the economy and how it affects our housing and our well-being. So thank you for highlighting that. We have about 5 minutes left, so I want to open the call up. If anyone has any additional questions or any lingering questions that they want to ask, or any thoughts that they want to share, any concerns that they're facing, please feel free to drop it in the chat, or if you feel comfortable coming off mute, I just want to open up and allow some space for that.
Yeah, hi. Thanks so much. This has been really eye-opening and thought-provoking. I'm Shannon Schumacher, and I'm with the Villages of Indiana, and I also represent the Indiana chapter of Prevent Child Abuse America. And it's been very interesting in the child welfare space that housing isn't more front and center when we have so many neglect issues that pop up because of unstable housing and insufficient housing. And so we actually spend a lot of money fundraising to pay for the crisis of I can't pay my rent this month, or I can't pay my bills this month. And if I don't pay my bills, it's going to, end up they're going to remove my child, etc. We're going to have our electricity turn, all of those things. And so just thinking about those resources around not homeless, but in these situations where they're living in unsafe environments, etc. So I didn't know what kind of resources that we might be able to tap into in terms of this kind of particular issue where they're still housed, not in good situations. Neglect is just knocking at the door to take their kids, etc. So just throwing that out there. Thanks.
I think I just want to, yes, there's a lot. And I think we talked a little bit about, the need for, I mean, James said it, the need for rental assistance, but it's only helpful if there's a supply. So I think that advocacy around housing quality is important. If we can, one, hold people accountable for the standard in which they keep things. The health department's really responsive when there are safety issues in a housing situation. If someone is on a voucher through Indianapolis Housing Agency, there's supposed to be housing quality standards held, and they can be held to that. So I think those things, I just wanted to mention, we haven't talked about that. Making sure that those reports are being made, that those kinds of things are being tracked, and that people from your communities are going and speaking out when we're talking about having more protections for tenants. I think we need more around diversion, because you're right, Shannon, like keeping people out of homelessness should be absolutely what is needed. And I know there's been a lot programs, pilot programs throughout my time in the homeless realm of Homeless Initiative Program did a pilot project about if homelessness is the only thing that's making someone call DCS or make a report, that housing is the focus that needs to happen. So how do we also keep families out of that because of homelessness? So I think having those creative processes on how do we partner to avoid further removal of children when it are system level things that are problematic. So I probably didn't help at all, but I wanted to add those couple of just thoughts I was having as you were talking.
And the other thing, all really good points, Lillian. And the other thing we haven't talked about yet is that you can go to your trustee's office to request assistance, although I don't know how people get assistance from the trustees. I would like to think that they actually distribute to somebody. We just never seem to be able to get it for our clients. But maybe we're just working with a group that's not the right group for them. And then sometimes the community centers have, rents available, just depending on kind of resources they can. So you can look at where your client lives and if they have a community center. And then there are sometimes religious organizations and groups that also help raise money if you're near the congregation or part of the congregation. So there are different ways you can there are some, things that might not be in the normal system of looking for support. And oftentimes those are things that will help people that are maybe not literally homeless, but they're having that struggle that you were talking about, and trying to keep them or help them get back to that stability moment.
Thank you. Thank you both for sharing. And thank you all for gracing us with your time today. I know that we are at time, so I want to respect everyone's time that they have on this Friday. But if you have any lingering questions or anything that you want to ask, any resources, feel free to stay on or send them over via email. We really appreciate your time today, and we look forward to seeing you all again. Our next conversation for this monthly call will be on April 19th, and we will be covering the recent legislative session with Sam Snyderman and Senator Fadi Kadora. So another very important conversation that impacts the work that we do and just how we orient ourselves throughout the community. So we really hope to see you again soon. And again, I just want to thank Lillian, Chelsea, Alan. The conversation was amazing. Personally, I learned a lot, and I really look forward to, doing what I can to help make an impact in any way, shape, or form. So again, if you have any questions or you want to exchange any resources, feel free to hop on or stay on or send me over an email, and I'll definitely do my best to connect you the best way I can. So thank you all again for joining in today.
Thank you. Happy Friday.
Happy Friday.
Deja, did you want us to stay on at all?
No, but I mean,
Okay.
thank you guys. This was amazing. I think this was amazing. I know we still have a few people lingering on. I'm not sure if they have any questions, so I'll just pause.
Well, and our contact info is on there to the last slide, right? So, and folks will get access to that if they want to reach out.
Yep, so when I send out the follow-up email, I'll be sure to CC you guys on there so they'll have your contact information directly, and then I'll be sharing out the resources that were provided on today's call as well. So I'll do my best to get as much information out there and as many resources out there as possible. But if there's anything that you want me to add, just go ahead and send it over and I'll be sure to include that as well.
Sounds great.
All
Great
right.
job, Lillian.
Yeah.
Great
You guys
job.
did amazing. Thank you guys again so much.
Thank you.
both. Have a great rest of your
Bye.
day.
You too.